So we're going to continue on with today's health premiums and taxation on health plans topic. We're going to try to get through as much of this as possible today. So let's jump right in. Taxation on health plans. The reimbursements exceeding expenses. Any amounts reimbursed in excess of expenses are considered income to the extent they can be linked to employer-paid premiums. Self-funded health plans. A self-funded health plan does not involve insurance risk and is therefore not insurance, nor does it have the effect of insurance for federal income tax purposes. Domestic partners. This is in relation to the definition for your medical plan. So health insurance plan contributions and benefits are included in income if made or received on behalf of an employee's life partner, non-spouse, cohabitant, or domestic partner under federal law. Same-sex marriages. An employee's spouse in a same-sex marriage recognized by a state who receives benefits provided by the employee's employer will have the value of benefits excluded from income. Employer-paid physical exams. The fair market value of a physical examination paid for by the employer is not excluded from income as a working condition fringe benefit, but it is excluded as an employer-paid medical care expense. Social Security, Medicare, and FUTA requirements to exclude employer contributions from employment taxes, Social Security, Medicare, and FUTA. The payments must be made under a plan. I have a quick question for everybody we wanted to ask before we got started. What is your preference for tomorrow because of the holiday? Can you just put in the chat what your preference is, if you're going to be available still for class, or if you would like us to push through as much as possible today for this topic? Oh, great. Okay. Then we won't have to worry about pushing too real hard today, and we can, go through things easily. Our first pop quiz of the day. Employees' adult children are covered under their employer's health insurance plan if the children are what? Nice job, everybody got that right. A, have not attained age 27 by the end of the taxable year. Non-discrimination requirements. All self-insured arrangements must adhere to non-discrimination requirements. For the purposes of this non-discrimination test, HCEs include the 5 highest paid officers, all owner of more than 10% of the employer's stock, and the top 25% of employees. In order to be non-discriminatory in terms of eligibility, the self-insured plan must benefit at least 70% of all employees and at least 80% of all employees who are eligible to participate in the plan, if at least 70% of all employees are eligible to participate, or a classification of employees the Secretary of Treasury finds to be not discriminatory. In terms of benefits, a self-insured plan is non-discriminatory if all the benefits provided to HCEs are provided to all other participating employees. If the plan is discriminatory, only those reimbursements and benefits that discriminate in favor of those HCEs are taxable. Taxes for discriminatory reimbursements. If the plan is discriminatory in terms of the eligibility, then use this formula for the taxable amount. So your taxable amount equals the amount paid to your highly compensated employees times all amounts paid to HCEs divided by all amounts paid to employees. If the HCE receives benefits other employees are not entitled to, then the full value of that benefit is taxable to that HCE. Health insurance arrangement, or HRA as it's more commonly called, is paid for solely by the employer and not provided pursuant to salary reduction election or under a 125 cafeteria plan. It reimburses the employee for medical care expenses incurred by the employee, spouse, and dependents and adult children until the year they reach age 27. And always keep in mind that rule of thumb is you're 26 until you're 27. So until you actually hit your birthday, that entire year, they're 26. An HRA also provides reimbursements up to a maximum dollar amount for a coverage period, with any unused portion of the maximum dollar amount at the end of the coverage period carried forward to increase the maximum reimbursement amount in subsequent coverage periods. HRA and FSA. Generally, if coverage is provided under both an HRA and a 125 health FSA for the same medical care expenses, amounts available under an HRA must be exhausted before reimbursements can be made from the FSA. The HRA may specify a coverage period for a reimbursement amount less than a year. HRA continued. Social Security, Medicare, and FUTA requirements. Once the existence of a plan is established, the Social Security, Medicare, and FUTA tax exclusion for employer contributions will apply if the plan is set up to benefit employees and their dependents. Payments to the plan by an employer will not be excluded if the plan benefits dependents only. Qualified small employer HRA. The law allows small employers that do not offer health insurance to their employees to offer a QSARA. They must be provided on the same terms to all eligible employees, be funded solely by the employer, pay or reimburse employees for medical expenses defined in IRC 213, following proof of coverage. Offer coverage to all employees except employees with less than 90 days, employees younger than age 25, part-time and seasonal employees, union employees, and non-resident aliens. The law allows small employers to pay single employees up to $5,250 and families up to $10,600 annually for their medical expenses. These amounts will be adjusted annually for inflation. So you always want to make sure you know if this HRA or QSARA applies to you. You need to know each year what those limits are. Here's a couple of examples. I'm not going to go through them. You can at your leisure, but you do have a couple of options to help think in the whole idea of what these HRAs do. There is a rule preventing HRAs from reimbursing for over-the-counter medicines that has been repealed. Under the Affordable Care Act, only the cost of medicines provided or prescribed by a doctor and insulin could be reimbursed by an HRA. A provision in the COVID Coronavirus Aid, Relief, and Economic Security, or CARES Act, repealed this provision. Once again, over-the-counter medicines can be reimbursed on a tax-free basis. This change is effective for expenses incurred in tax years beginning after December 31st, 2019. The CARES Act also added menstrual care products as a qualified medical expense. I would not be surprised if questions like this are on your exam. Pop quiz. Health arrangements, or HRAs, are paid for by great. Yes, an HRA is paid solely by the employer and not provided pursuant to a salary reduction election or under a 125 plan. Health savings accounts, or HSAs. You want to make sure you know really well the difference between FSA, HSA, and HRA. HSAs are created by individuals or employers for the employees and in general is a tax exempt item. Eligible individuals. HSAs may be established by individuals who are covered by a high deductible health plan, HDHP, which is defined as a plan with an annual deductible of at least $1,400 for 2021, and that remains unchanged coming up for 2022. In the case of self-only coverage, or $2,800 for 2021, unchanged for 2022. In the case of family coverage that has an out-of-pocket expense limit of no more than $7,000 for 2021, or $7,050 in 2022. In the case of self-only coverage and $14,000, so that's going to be your maximum out-of-pocket, $14,100 coming up in 2022. In the case of family coverage, these amounts are adjusted for inflation annually to the nearest multiple of $50. So this is telling you HSAs have to be tied with a high deductible health plan. Contributions not included in income. Both the employer and the employee can contribute to the employee's HSA. All contributions are aggregated for purposes of the maximum annual contribution limit. The maximum annual contribution that can be made to an HSA in 2021 is $3,600 for self-only coverage and $7,200 for family coverage. Individuals age 55 and older can make additional catch-up contributions to an HSA. The additional contribution is 1,000 years in all years going forward at this point. HSAs continued. So your rollovers. Amounts can be rolled over into an HSA from an Archer MSA or other HSA. Comparability rule. If an employer makes contributions to an employee's HSA plan, the employer must make available comparable contributions to all employees with comparable coverage during that same period. Distributions are for qualified medical expenses of the individual, spouse, or dependent, and those are excluded from gross income. Those qualified medical expenses include expenses for diagnosis, cure, mitigation, treatment, or prevention of disease. That includes prescription drugs, over-the-counter medicines prescribed by a physician, transportation primarily for and essential to such care, and qualified long-term care expenses. They also include health insurance premiums for individuals eligible for Medicare, other than premiums for Medigap policies. So there's those little caveats that you would need to make sure you know. The reporting requirements. Employer contributions are required to be reported on the employee's Form W-2 in Box 12, Code W. Good to know. Examples of your HSA. I'm going to give you guys a second to just kind of read those. So HSA and COVID, because why not? Everything, COVID affects everything. The IRS provides COVID-19 related flexibility for high deductible health plans. In response to the COVID-19 pandemic, the IRS has provided flexibility for certain high deductible health plans. The IRS said in Notice 2020-15 that health plans that otherwise qualify as high deductible health plans will not lose that status merely because they cover the cost of testing for or treatment of COVID-19 before plan deductibles have been met. The IRS also said any vaccination costs continue to count as preventative care and can be paid for by an HDHP. The IRS subsequently issued Notice 2020-29 which allows the relief granted in Notice 2020-15 to be applied retroactively to January 1st, 2020. Notice 2020-29 also provides that the exemption allows high deductible health plans to cover telehealth services, which was included in the Coronavirus Aid, Relief, and Economic Security, or CARES Act, for telehealth services applies retroactively to January 1, 2020. Pop quiz. Of the following health plans, which is not considered a health insurance plan? Great. D, HRA. You're absolutely right. That is not considered a health insurance plan. So the Family Medical Leave Act, one of the major pieces of social legislation to be enacted during the 1990s, was FMLA, or the Family Medical Leave Act. In general, FMLA allows employees in workplaces with 50 or more employees to take up to 12 weeks of unpaid leave in any 12 months to be with a newborn or newly adopted child, to take care of a seriously ill son, daughter, spouse, parent, to care for themselves if they're seriously ill, or because of any qualifying exigency arising out of the fact of the employee's spouse, son, daughter, parent that's a covered military member on active duty or has been notified of an impending call to active duty in support of a contingency operation. An employee is allowed to take up to 26 weeks of leave in a single 12-month period to care for a covered military service member with a serious injury or illness. The law also guarantees continuation of employees' health benefits while on that leave. Not just important to know for the test, that's important to know while you're doing your job. And of course, again, COVID. So we've expanded the FMLA for temporary COVID reasons. Effective April 1st through December 31st, 2020, the Families First Coronavirus Response Act, FFCRA, expanded the reasons for which FMLA leave can be taken to include where an employee is unable to work or telework due to a need to care for a son or daughter under 18 years of age, where the child's school or place of care has been closed, or a child care provider is unavailable due to a public health emergency. At the end of 2020, legislation was enacted that extended the tax credits available to employers for providing the expanded leave. Employers that would have been required to provide the leave under the FFCRA had the requirement to provide the expanded leave, not expired, may receive tax credits for the qualified leave wages paid for leave taken through March 31st, 2021. Then, of course, the ARPA, or American Rescue Plan Act of 2021, extended the tax credits again for employers that voluntarily provide qualified leave wages for expanded family and medical leave taken through September 30, 2021. ARPA also greatly expanded the reasons for which an employee may take expanded medical leave. For leave taken before April 1st, 2021, eligible employees of employers voluntarily offering the leave may take up to 12 weeks of this emergency leave, with the first 2 weeks being unpaid, or the employee may substitute vacation leave, personal leave, or sick leave for those unpaid wages, and the remaining 10 weeks being paid at a rate of at least 2/3 of the employee's regular rate of pay, not required to exceed $200 per day. Employers may pay more than the $200 per day, but the wages exceeding the limit are not eligible for those tax credits. The same daily dollar amount applies to leave taken after March 31st, 2021. However, the employee may be paid, and the employer may claim a credit for all 12 weeks of leave up to $12,000. Beginning on April 1st, 2021, the ARPA expanded the reasons for which expanded family and medical leave may be taken to match the qualifying reasons for emergency paid leave under the FFCRA, including 3 new reasons. The new reasons are to receive a COVID-19 vaccination, to recover from an illness related to the COVID-19 vaccination, or to get tested. So it's not even just waiting, someone who actually has that positive test. Examples of FMLA. I will give you a second to read this. Okay, moving right along, COBRA. Another fun topic, huh? So the Consolidated Omnibus Budget Reconciliation Act, or as we lovingly call it, COBRA, of 1985 requires health plan sponsors to provide employees and their beneficiaries with the opportunity to elect continued group health coverage for a given time period should their coverage be lost due to certain qualifying events. The time period for continued group coverage is generally 18 or 36 months, depending on that qualifying event. The continuation coverage must be the same as that provided to similarly situated beneficiaries. Qualified beneficiaries entitled to coverage are spouse and or dependents. Those qualifying events are death of the covered employee, the covered employee's termination of employment other than for gross misconduct or reduction in hours worked, divorce or separation from the covered employee, entitlement of the covered employee to Medicare benefits, and of course, upon enrolling in the program, a dependent child losing their status, bankruptcy proceedings that cause a retired covered employee or the employee's dependents to lose coverage. The COBRA period of coverage, where the qualifying event is the employee's termination or reduction in hours worked, they would get 18 months or 24 months if the reason for absence from employment is the employee's military service. But if another qualifying event occurs during the 18-month period, other than commencement of bankruptcy proceedings, the period is extended to 36 months. Where the qualifying event is the employer's bankruptcy, the life of the retiree or the retiree's spouse, but once the retiree dies, the period of continuation coverage for the retiree's spouse and children is 36 months from that retiree's death. Where the qualifying event is the employee's termination or reduction in work hours and a qualified beneficiary, employee or dependent, is disabled under the Social Security Act at any time during the first 60 days of continued coverage, 29 months for all qualified beneficiaries entitled to continued coverage because of the same qualifying event. Where the qualifying event is the covered employee's death, divorce, separation, or entitlement to Medicare, or a covered child's loss of coverage of status, covered child status, that's 36 months. COBRA continues. Continuation coverage ends before these maximum coverage periods are reached if the employer ceases to provide group health coverage, the required premium for the continuation coverage is not paid within 30 days of the due date. The qualified beneficiary becomes covered under any other group health plan. The qualified beneficiary becomes entitled to Medicare benefits unless it's the employer's bankruptcy is a qualifying event. And of course, we're going to add in some temporary COBRA premium assistance due to COVID-19. The ARPA, or American Rescue Plan Act of 2021, provides for COBRA premium assistance for certain assistance-eligible individuals, AEIs, for COBRA continuation coverage for periods of coverage from April 1st through September 30th, 2021. Employers may claim a payroll tax credit equal to the amount of the COBRA premium assistance that they pay. COBRA still continues. Premium requirements. The group health plan can require the employee or the qualified beneficiary to pay a premium for the continuation of coverage up to 102% of the group premium for the similar coverage under the plan the employer and its employees. The individual can choose to pay the premiums in monthly installments. The maximum premium increases to 150% for disabled qualified beneficiaries after the 18th month of their continuation coverage, whether the maximum coverage period becomes 29 or 36 months. The first premium payment may not be required earlier than 45 days after the qualified beneficiary elects that continuation of coverage. Election and notice provisions. Employees and other qualified beneficiaries who wish to take advantage of continued group health plan coverage must make an election of such coverage. The election period must last for at least 60 days and can begin no earlier than the date on which coverage was terminated because of that qualifying event. The election period also cannot end before 60 days after the qualified beneficiary receives notice of the termination of coverage. Test tip there, know those time frames for COBRA, very important. So your COBRA election and notice provisions. Employees and other qualified beneficiaries who wish to take advantage of continued group health plan coverage must make an election of such coverage. The penalties for non-compliance. Employers that fail to comply with COBRA are subject to a tax of $100 per day of non-compliance for each qualified beneficiary. That maximum is $200 per day per family. FMLA and COBRA interaction. Of course, they're going to combine. A synopsis of the service conclusions regarding FMLA and COBRA interaction is as follows. FMLA leave in itself does not constitute a qualifying event. There's no qualifying event if the employer eliminates group health coverage for a class of employees that would have included a covered employee had that employee not taken FMLA leave. A lapse of coverage under a group health plan during FMLA is irrelevant in determining whether a qualifying event has occurred. The right to COBRA continuation coverage cannot be conditioned on the employee's reimbursement of such premiums. State or local laws regarding group health plan coverage to be maintained for a longer period of time than under the FMLA are disregarded for purposes of determining when a qualifying event occurs under COBRA. Affordable Care Act. The ACA requires larger employers to provide health insurance. One of the major components of the healthcare reform legislation enacted in 2010 is the requirement that applicable large employers or ALEs provide affordable health insurance to their full-time employees that provide minimum essential coverage or MEC of at least the minimum value MEV. That is the employer shared responsibility ESR requirement. Employers that do not provide such insurance may be assessed an ESR penalty if one of their employees obtains insurance through a healthcare marketplace or an exchange. In doing so, they receive a premium tax credit or subsidy. The legislation is commonly known as the Affordable Care Act, or ACA, and it's made up of the Patient Protection Affordable Care Act and the Health Care and Education Reconciliation Act. ESR and ALE for ACA. Employers employing at least 50 full-time employees, including full-time equivalent employees, are subject to the ESR provisions under the IRC 49808. As defined by the statute, a full-time employee is an individual employed on an average at least 30 hours per week. An employer that meets the 50 full-time employee threshold is referred to as an applicable large employer, ALE. You'll want to know that. Identification of full-time employees for purposes of the ESR provisions. For purposes of the ESR, an employee is a full-time employee for a calendar month if the employee averages at least 30 hours of service per week. 130 hours of service in a calendar month is treated as a monthly equivalent of 30 service hours per week. Determination of status for variable schedule employees. You have a monthly measurement method. That's where the employer determines each employee's status as a full-time employee by counting the employee's hours of service for each month over successive 1-week periods. For 4-week calendar months, employees with 120 hours of service are full-time employees. For 5-week months, employees with 150 hours of service are full-time employees. You have a look-back measurement method for only for the purposes of determining liability for that ESR payment. Hours of service refers to any hours the employee is paid or entitled payment, so it does include your vacation and sick. The Employer Shared Responsibility, ESR. The IRS has issued guidance for the Affordable Care Act's Employer Shared Responsibility, or ESR, provisions regarding employee health coverage. Employers subject to the ESR provisions, any employer is an applicable large employer, ALE, if within the look-back period of the previous calendar year, they employed at least 50 full-time employees, including those full-time equivalent employees, or FTEs. Seasonal employees working less than 120 days in a calendar year do not contribute to that ALE count. So an employer that employs 40 full-time employees and 20 employees employed 15 hours per week on average, so your 20 times 15 is 300 hours. 300 divided by 30 is 10 full-time employees, has the equivalent of 50 full-time employees, and would be an ALE. So that's the 40 full-time employees plus 10 full-time equivalents. ESR eligibility is determined annually. If an employer has at least 50 full-time employees, including FTEs for 2019, it would be considered an applicable large employer for 2020. More about the employer share responsibility. Your common ownership. Companies with a common owner or are otherwise related are generally combined for purposes of determining that ALE status. If the combined total meets the threshold, each separate company is then subject to those ESR provisions. So then each company would need to provide affordable health care. An ALE will be liable for an ESR payment only if the employer does not offer affordable health coverage that meets the MEC or minimum essential coverage or the MEV minimum essential value to fewer than 95% of its full-time employees. If an employer meets the requirements of any of these safe harbors, the offer of coverage will be deemed affordable regardless of whether it was affordable to the employee for purposes of the premium tax credit. So Form W2 wages for safe harbor calcs, that's which is 9.83% of wages paid to the employee are reported in box 1 of the employee's W2. Your rate of pay safe harbor, 9.83% of the employee's rate of pay or salary at the beginning of the coverage period, with adjustments permitted for an hourly employee if the rate of pay is decreased. Of course, not if the rate of pay is increased. The federal poverty line safe harbor, which generally treats coverage as affordable if the employee contribution for the year does not exceed 9.83% of the federal poverty line for a single individual, which is $12,760 in 2020 for the applicable calendar year. You'll also want to make sure that you know what that federal poverty line is each year. The ESR payment, minimum value coverage. A plan provides minimum value if it covers at least 60% of the total allowed cost of benefit expected to be incurred under the plan. So if it's qualified, it has to meet that minimum value coverage. An ALE that does not offer coverage or offers coverage to fewer than 95% of its full-time employees and their dependents, the ESR payment owed is equal to the number of full-time employees, not those FTEs though, that the employer employed for the year minus up to 30 multiplied by $2,570 for 2020, as long as at least one full-time employee receives the premium tax credit. So it can get rather pricey. Coverage for some months, but not others. The payment is then computed separately for each month for which coverage was not offered to employees. Coverage offered to at least 95% of full-time employees and their dependents. The employer's payment is computed separately for each month. A cap ensures that the payment for an employer that offers coverage can never exceed the payment that employer would owe if it did not offer the coverage. The ESR payment. If you're owing an ESR payment, the IRS will issue letter 226J to employers to inform them of their potential liability and provide them an opportunity to respond before any liability is assessed, and it must be addressed within 30 days of the date of the letter. The IRS determines that the employer is liable for the ESR payment. If the IRS determines it, they will send a notice and demand for payment. The Affordable Care Act, or ACA, requires each marketplace to notify employers if any of their employees were eligible for marketplace coverage and advanced premium tax credits, or APTCS. Employers in many states receive federally facilitated marketplace. We're giving you all these acronyms, it's crazy, FFM. Notices if any of their employees enrolled in health insurance marketplace coverage and were eligible for an advanced premium tax credit or cost sharing reductions. The Centers for Medicare and Medicaid Services, or CMS, has posted a sample employer letter to help employers plan if they receive one. We're about 20 minutes before the hour, but we're gonna go ahead and stop because we're done with the ESR area. We're gonna go into more ACA stuff tomorrow. And you guys are all gonna be here tomorrow, so we'll finish up with our last little segment tomorrow. Does anybody have any questions?
Thanks, Rebecca.
Great, we'll see you guys all tomorrow.
Thank you.
See ya, bye.
Bye.